Sunnybrook Health is known as a leader when it comes to trauma care.
But what happens when a patient gets through their treatment and returns to regular things like working or starting a family? Our health reporter Pauline Chan has more on their unique accessible care pregnancy clinic.
Eloisa Valles is back at Sunnybrook, visiting the staff that helped her bring little Emily into this world last November. But she was afraid that would never happen.
Eloisa had only been in Canada for 1 year when she was struck by a car in 2020 and brought to the trauma unit here at Sunnybrook.
She had pelvic fractures, she had fractures in her legs, ligament problems, multiple surgeries afterwards, chronic pain, bladder concerns, traumatic brain injury. So it was a lot that happened.
So in total were 5 surgeries and 3 small procedures and a lot of physio, and so it was 4.5 years just dedicated to my recovery.
She said it was like a beautiful circle, that the hospital that she first came to with her devastating injuries also had a clinic for women with special pregnancy needs like herself.
That gave me hope. I mean, she assured me that I could have a baby and it could be as normal as I thought that it couldn't.
Dr. Ann Burndle had worked with people who had other disabilities in the past, and she saw a need for pregnancy preparation for them and for people who had suffered traumatic injuries.
We know that people who've been in a trauma are more likely to deliver prematurely, they're more likely to have chronic pain, they're more likely to have small babies, they're more likely to be re-hospitalized. So there are a lot of concerns that go along with someone who has been in a trauma, and it's important that that person feels like they're going in with all the information.
The Jennifer Torrey Trauma Clinic offers a year of support after a patient completes their acute care at Sunnybrook Trauma.
In 2021, we changed our focus to beyond surviving, but also ensuring that patients were thriving after discharge, which means trying to get patients back to their families, back to work.
There's surgical follow-ups, we have a spinal cord injury clinic, a chronic pain clinic, we've got an occupational therapist, a social worker, myself, we have physiotherapy.
Including support from the Accessible Care Pregnancy Clinic. For a medical team accustomed to seeing people in their worst situations, a chance to see happy endings like Emily are truly a special occasion. Pauline Chan, CTV News.